Everyone, this is Mike. Welcome back. So today, how might an Adlerian therapist treat depression? All right, so an Adlerian therapist views depression not as a disease, but as a state of discouragement stemming from a feeling of inferiority and a lack of social interest or belonging. The core idea is that individuals are striving for significance and belonging, and when these strivings are frustrated or misdirected, depression can arise. So here's how an Adlerian therapist might approach the treatment of depression following a four-stage process. 1, establishing a collaborative relationship, engagement. So the first and most crucial step is to build a warm, empathic, and trusting therapeutic alliance. The therapist works collaboratively with the client, demonstrating genuine respect, encouragement, and faith in their abilities. This fosters a sense of equality and mutual respect, which is vital for a discouraged individual. The client is not seen as sick, but as a person who has become disheartened and needs guidance to reorient their goals and beliefs. 2, assessment and understanding the lifestyle. Okay, assessment. The therapist will explore the client's lifestyle, which is their unique way of thinking, feeling, and behaving developed in early childhood. This involves early recollection, exploring the client's earliest memories, as these are believed to reveal fundamental convictions about the self, others, and life. Family constellation, understanding the client's birth order, sibling relationships, and family dynamics, as these significantly influence personality development. Basic mistakes, identifying distorted beliefs or faulty assumptions about life, such as, I must be perfect, I'm unlovable, life is unfair. These mistaken goals often underpin feelings of inadequacy and contribute to depression. Private logic, uncovering the client's private, often unconscious reasoning that justifies their behavior and beliefs. And goals and behavior. While depression might manifest as withdrawal or inactivity, Adlerians believe all behavior is purposeful. The therapist aims to understand the purpose behind the depressive symptoms, for example, to avoid perceived failure, gain sympathy, or control others. 3, gaining insight. Once the lifestyle and underlying patterns are understood, the therapist helps the client gain insight into their mistaken beliefs and the self-defeating patterns that contribute to their depression. This involves gentle challenge and interpretation, helping the client to see how their current ways of operating are not serving them. The therapist might ask questions like, could this be true? To encourage critical self-reflection. The focus is on helping the client understand the why behind their depression and how their striving for significance has been misdirected. And 4, reorientation and encouragement. This stage is about helping the client develop new, more constructive ways of thinking, feeling, and acting. Encouragement. This is a cornerstone of Adlerian therapy. The therapist actively encourages the client, highlighting their strengths, progress, and capacity for change. This counteracts the client's discouragement and bolsters their self-esteem. Developing social interest. A key tenet of Adlerian psychology is that mental health is tied to a sense of belonging and contributing to the community. The therapist encourages the client to engage in meaningful social activities, even small ones, to overcome feelings of isolation and develop a sense of purpose beyond themselves. Setting meaningful goals, helping the client identify and pursue realistic, socially beneficial goals. Depression often arises when individuals feel unable to achieve their goals, so redefining and working toward achievable goals is critical. Action and behavioral change. The therapist works with the client to implement new behaviors outside of therapy sessions, challenging them to take small risks, confront fears, and engage in activities that increase their sense of competence and connection. This might involve assigning homework activities. Challenging spoiling. If the depression is seen as serving a purpose, getting attention or avoiding responsibility, the therapist might gently challenge these spoiling patterns, helping the client find more constructive ways to meet their needs. In essence, an Adlerian therapist empowers individuals with depression by helping them understand the origins of their discouragement, challenging their mistaken beliefs, fostering a sense of belonging and purpose, and encouraging to take active steps toward a more fulfilling and socially connected life. The process is educational, collaborative, and future-oriented. So what do you think about how Adlerians would treat depression? Do you think that would be helpful? Let me know in the comments, and I'll speak to you next time.